A year-long police campaign has been launched to guide the public on how to respond when they witness sexual crimes. The aim is to encourage the community to take appropriate action to tackle or prevent such crimes from happening. Molestation cases in Singapore rose by about 7% last year to about 1,530 cases compared to the previous year. About 3 in 4 took place in public areas such as nightspots, supermarkets, shopping malls, and on public transport. The year-long campaign highlights how the public can spot suspicious behaviour, protect a potential victim, observe key details, and inform the police. Posters and messages will be put up across the island.
For the spot action protocol to be effective, we must not be afraid to report a sexual crime. Each of us can make a difference and prevent harm from being perpetrated by choosing to act and protect sexual crime victims. Victims are also encouraged to step forward and report a crime regardless of when it happened. Doing so as soon as possible can help preserve evidence, prevent further harm, and bring a perpetrator to justice.
Early and timely reporting is very crucial for a case to be solid and be able to really address the whole perpetrator side of things as well. Really to teach people what to look out for, what are the steps that they can take in order to be active members of society to help such survivors. And the first response is always very crucial.
And for more, I'm joined by psychiatrist Dr. Adrian Wang. Dr. Wang, good to have you with us.
Thank you.
Well, let's start with the outrage of modesty cases. That rose 7.3% in 2025, with many occurring in public spaces. How concerned should we be about that number?
I think we should be a little concerned, but an increase in numbers doesn't mean there's an absolute increase in numbers. It could be that people are more willing to step forward, so there's a decrease in stigma associated with reporting such cases. It could be because people are more vigilant, there's more CCTVs and cases are detected. So that's actually a good thing. It does mean that the system is working and people are coming forward. But on the other hand, it could also mean that, yes, there could be an absolute increase. People are getting more stressed in crowded places, in public transport. Certain issues persist, workplace harassment, online harassment. So these are areas we need to look at. But an absolute number may mean more than just an increase in absolute numbers.
And to tackle this rise, campaigns are encouraging people now to not just be, bystanders when such things happened. What do you think are some of the reasons why people here might be a bit reluctant to step forward, even if they witness something?
So the bystander effect. I think there is some nuance to this. Firstly, I think as a culture, we tend to be a bit more reserved. And like we were saying earlier, nobody wants to be a hero. Nobody wants to step forward. So there's a fear of embarrassment and doing the wrong thing. And sometimes we're afraid that, hey, what difference can I make anyway? I probably can't do anything. I'm too weak. There's a fear of being injured and causing harm to yourself. But as long as we don't do anything, then bad people can continue doing those bad things. So even small interventions, stepping forward, asking, hey, are you okay? Distracting the person and starting a neutral conversation and directing the person away from harm. Small things like that can help keep vulnerable people and women safe.
What do you think would it take for us to get more people to step in and to step forward, given the challenges you've just mentioned?
Public education. I think we need to tell people that we need to create a safe space for vulnerable populations, for children, for women to exist and work in. So public education, knowing that some things are not okay, knowing that boundaries must be drawn, certain behaviors are not acceptable, and also knowing how and where to get help, that authorities and people will step in, the police, organizations will step in and help.
The sexual assault cases have remained about 2,500 a year in Singapore. In your view, do you think this reflects prevalence? Do you think there's greater awareness, as you alluded to just now? Or are more people coming forward to report?
I think it's a bit of both. I think people over the years have realized that certain behaviors are not acceptable. I think in my line of work, where I see people with anxiety and depression, sometimes being harassed, being bullied, and that includes sexual harassment, that's a topic that does come up more frequently these days.
Well, for viewers who feel quite unsettled by these statistics, right, how can we stay vigilant but not overly anxious or fearful when we go out in public, or even sometimes when we witness something, that we're able to stay level-headed and calm and handle the situation?
I think this campaign to increase public awareness is a good thing. So we must know what behaviors are acceptable and certain things are not acceptable. I think we need to be a bit bolder to be able to approach and reach out to help someone if they're in trouble. And like I said, establishing some eye contact and asking, hey, are you okay? So small things that each member of the public can make in a public setting on the bus can help people. And like I said, we need to create a safe space for women and kids to be in.
Yeah. So as you mentioned earlier, you do see some of your clients that do go through some of these situations. So what are some long-term mental and emotional impacts you see victims of, sexual assault or molestation cases? Like, what do they go through in the long run?
Well, victims suffer both in the short term and the long term. In the short term, of course, they feel shock, disgust, guilt. But in the long term, there are a few things that can happen. It can lead to anxiety. It can lead to depression. People can develop post-traumatic stress disorder. PTSD is when you experience flashbacks, when you're hypervigilant, when you're fearful of things that remind you of the situation. It affects relationships with others. It creates distrust. It causes problems within the person. They feel guilt. They blame themselves. Their self-esteem is affected. So relationships, themselves, and even sexual health and problems with intimacy can occur in the long term.
So from the perspective of a loved one, let's say you're a family member or a friend who knows of someone who has gone through such an experience, how do we step in a way that shows our concern, but also is very tactful of what has happened?
So like you said, be tactful, show concern, show that you're there. Don't press the person for details. Don't press or force the person to report straight away. Be available. Listen non-judgmentally. Don't say, hey, why did you dress like that? Why do you follow that guy into the car, etc. Don't say things that may trigger the person. Be non-judgmental, and over time, encourage them to seek help. Speak to a doctor, speak to a counselor, and give that person time.
Well, very quickly before we go, if someone has gone through a situation like that or witnessed, for example, if you could kind of give us a way or an example of how to actually intervene. So let's say I witness someone or something that seems to make someone uncomfortable. How do I step in?
Well, you could try and make eye contact with the victim. You could go up to the person and just say, make a neutral, like, are you okay? Do you need help here? Or pretend, hey, I know you from somewhere. You're my colleague from those years ago, and try to distract that person and try to lead them away from the dangerous situation. And once you're in a safe space, ask the person, are you okay? Can I call someone for you? Can I get in contact with your parent or your partner or your friend? So direct them away by saying something neutral.
Dr. Wang, thank you for sharing all those tips with us. I've been chatting with Dr. Adrian Wang from Dr. Adrian Wang Psychiatric and Counselling Care.